Welcome to The Heart of Health Live. There's a place for modern medicine in your life. Learn to use it correctly by getting your toughest questions answered on today's broadcast. Discover modern medicine's strengths and weaknesses. Lifestyle medicine opens the door to optimum health and healing. How you live and what you eat can profoundly affect mind and body. Learn simple solutions to complex problems. God provides the ultimate healing we all desire. He wants us healthy and happy. We just need to understand His plan for our lives and live accordingly. And now, live from Studio 1A in Chattanooga, Tennessee, here's your Heart of Health host, Dr. James Markham.
Good afternoon and evening, wherever you might be watching, and welcome to the Heart of Health Live. I'm your host, Dr. James Markham, and I'm so glad you're joining us, spending a part of your day to learn about your body and to learn all sorts of neat things. We also want to welcome those who are joining us tonight on the Three Angels Broadcasting Network. You are actually a very important ingredient to this program. And this is a live program, so you can call in with your questions. If you dial 855-644-3278, you'll get our call center. We might get your question on live. For sure, we can write it down and maybe answer it so you can be part of the program. This evening, we're going to be talking with Dr. Brent Barrow. He's a radiologist that works for Vista Radiology. Radiologists work with imaging and x-rays and all sorts of neat things. So if you might have a question about that or want to learn about that, this is where you want to stay tuned. Heart of Health is a little bit different type of programming. There's no gimmicks here. We're not selling a product. We just want to give you good information and to help you have better health. You know, there's some people that just focus on lifestyle. There's some people that just focus on the medical part of it. And there's an important part for acute care medicine. But what we add to the mixture is we let people know that it's that relationship with the Heavenly Father that's very, very important. And in that relationship, you can learn new truths. You can also develop a different rapport with others. And also it can give you the strength to make the changes that are so hard in this well-marketed world. So we want to thank you for joining us. We're here with Dr. Brent Barrow. You're going to want to get in your questions here. So give us a call. Our number is 855-644-3278. You can go to our website if you want to leave a question. That's heartwiseministries.org. Or you can even be our Facebook friend. Stay with us. We're going to be back and introduce Dr. Barrow after this short break.
Heart of Health Live will return in just a moment.
Thanks for watching the Heart of Health Live, right here on the NRB Network.
I'm Dr. James Markham with your medical moment. I don't know about you, but I get thirsty if I talk a lot. Well, one of the greatest needs of our body is water. Did you realize that up to 70% of our body is water? All the chemical reactions from the brain to the heart beating to the muscles moving all depend on water. It's one of the most important substances we put in our body. If we get dehydrated, many bad things happen. We can have inflammation, we can have the blood thickened, we can have blood pressure changes, we can even have our heart race. You don't want to be walking around in the desert. Hydrate yourself. How much do you need? Divide your weight in two, that's about how many ounces. Or drink enough water till your urine comes out clean. Remember, water is one of the most important ingredients we put in ourselves every day.
To learn more about your health and discover what Dr. Markham is doing in your area, visit heartwiseministries.org.
Imagine a classroom with no boundaries. A classroom where reenacting a book is an English class, and repairing a motor is a math lesson. A classroom where caring for horses is biology. This is our classroom. At Bachman Academy, 6th to 12th graders with ADHD, dyslexia, and other language-based learning differences are provided a language-rich, hands-on program of study. With an average of 5 students per teacher, Bachman students receive more attention and have more time to learn while using their own learning strengths. Now, imagine your child in this classroom. To learn more about Bachman Academy, visit our website at www.bachmanacademy.org. Bachman Academy, tapping potential one person at a time. So here's a question. If you love Jesus, and I mean truly love him, people will notice, right? I mean, if Jesus is at the center of everything you do, people will have to notice. And that is exactly what Life Talk is all about. You see, at Life Talk, our goal has always been to connect people to the true source of power, Jesus Christ. We know with Jesus at the center of our lives, nothing is impossible.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back, and I want to introduce to everyone that's watching Dr. Barrow. Dr. Barrow, thank you for joining us on Heart of Health Live.
Jim, my pleasure.
And tell us, for those that don't even know what a radiologist is, we know it's a big word, we know it's a type of medical doctor, but tell us, what is a radiologist and how does one become a radiologist?
Well, medical school is that kind of that introductory ground that all of us get to all the different kind of specialties and some specialties of medicine. And then for those that are become interested in radiology, you kind of choose that as your path of choice.
Right.
Internship after medical school, and then your residency of choice. I did mine in Atlanta.
Okay.
Some choose after they finish their residency to go straight into practice. Some choose to do what's called a fellowship, which is additional years of training in kind of a subspecialty area.
Okay.
And I ended up doing a subspecialty in vascular interventional radiology.
Well, exactly what is radiology?
Well, radiology is in the broad term, it is going to be the imaging studies that are performed on the patient.
Okay.
From a radiologist standpoint, we tend to be the interpreters of those studies, be that your x-ray of your ankle or your foot when you've stubbed your foot and ankle, to reading the CAT scans and ultrasounds and MRIs, PET scans, other nuclear medicine studies, all are interpreted by radiologists.
So you really help make the diagnosis.
We do, and we tend in most cases to be kind of we help the doctor make the diagnosis. If a doctor has a question about this patient has abdominal pain, what's going on? They send them for a specific test or ask us what may be the best test.
Okay.
And we then, those tests get performed by the x-ray technologist, which is what the patient typically sees. We review the study, and then we'll get reports to those referring physicians in a means of trying to help them help in the care of their patient.
Okay.
Sometimes we do have direct interaction with the patients, but a lot of what I do every day, I have direct interaction with the physician who then interacts with the patient.
So a patient might come in, or someone might out that has a symptom,
Yes.
and the doctor says, well, let me investigate that, and then they'll figure out what test is the best, and then they'll do the test, and you'll interpret that test and send it back to the doctor.
Yes.
Now, do you have you actually see patients, or how long have you been doing this? Do you have any experience in this? They're going to ask you questions. I mean,
I've been doing, I guess, radiology since 1990.
Okay.
And have been doing procedures with patients since probably 1991.
Okay.
Been in private practice since 1995.
Okay, so you've been doing stuff for quite a few years here, so that's good. So I think you're qualified to answer our questions here, and we want to thank you for being with. The first question we have, and we might not get to all of it before the break, but we'll get to part of it before the break.
Okay.
It comes into our website. It says, do radiologists deliver treatment or just help in the diagnosis? We talked about the diagnosis.
Good
you
question.
guys do treatment too?
Well, we do, and that was kind of turns out that's kind of the fellowship that I did, the vascular interventional, where we do kind of a special interest in procedures related to patients. A lot of those procedures have to do with the vascular system, be it arteries and be it veins, angioplasties and stent placements, have a number of different things here in front of us. Everything from just the typical balloon catheter. This is just a catheter that we would use in a patient to say if they had a blockage, similar to the catheter that cardiologists use in the blockages that you all see in the coronary arteries. And if you watch the end of this catheter, as I blow this up,
whoa!
That's the 1 lumen. Now we know the catheter's patent, and here's the balloon as it expands. And so now, if you can imagine that being inside of a vessel that was originally much smaller, and then when I blow this up, we've just made it bigger.
So you can open up blood flow?
Open up a blood flow. Open up a blood flow. Sometimes we use this by itself.
Okay. Now I'm going to stop you right there because
Okay.
we got to go to break.
All right.
But after we go back to break, we're going to learn more about the different interventions that you do, and we're going to start answering questions. And
Great.
You're watching Heart of Health Live. Our phone number, if you want to be part of the program and have a question, it's 855-644-3278. And our expert guest is Dr. Brent Barrow. He's a radiologist with Vista Radiologist. We also want you to join us on Facebook. You can be one of our Facebook friends. Stay with us. We're going to be right back after this short break on Heart of Health Live.
The Heart of Health Live will return in just a moment.
I'd like to think that one day, when we get to heaven, we're going to see a list of people. People like Jared and Susan, who were introduced to Jesus because of something we said. Or maybe it was as simple as a passing smile. But these people will look into their past and be able to say, I'm here because of you. Recently, you may have heard that Heartwise Ministries has begun spreading the gospel to the young, the old, the sick, and the healthy using this very television program. But we need your help. We want to take this type of medical programming to the non-believer and the person who has closed themselves off to traditional forms of outreach. If you believe as we do and want to support Heartwise so that together we can count more names on the Tree of Life, please consider donating today at heartwiseministries.org. That's heartwiseministries.org.
My life is full of statistics. Thing is, I could have dropped out of school and become one myself, but I didn't because I had people that believed in me. Here's another statistic. 7,000 students drop out every school day. That's one every 26 seconds. It's time that students know that we believe in them.
Inspire a student and share your message of support at boostup.org.
There's a place for modern medicine, but that's not enough. There's a place for lifestyle, but that's not enough. The real truth in medicine, the real truth in healing comes from that relationship with the Heavenly Father. That relationship can show us the balance, when to use modern medicine, when to use lifestyle, and to use it for the right reasons. Well, this book gives the solution to the healthcare dilemma. It answers the question, why am I sick? How do I get better? And how can I have ultimate healing?
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Well, thank you for joining us. We're here talking about radiology with Dr. Brent Barrow, and specifically we want to answer your questions live regarding radiology topics. So give us a call if you have a question about radiology, 855-644-3278. And Dr. Barrow's last segment, we were talking about how you perform treatment. Yep. And you were showing us about the balloon catheter.
The angioplasty balloon. And a step beyond that, as we have kind of progressed in the treatment of, say, vascular disease and in the peripheral system as well as in the coronary system, originally all we had was balloon angioplasty, and that's the best we could do. And then we've developed beyond that into metallic stents. And this is a device that actually goes in through a catheter that looks very similar to this in size. And then once it's deployed, it actually turns into something that looks more like this.
Wow.
And of course, this has much greater rigidity to it than the vessel wall itself, so it kind of keeps things open. You put a balloon in a vessel, you can open something up, and then if the stenosis that's there recoils, it can close back down even after the balloon's been taken out, because you can't leave the balloon in indefinitely. This, as a stent, we can put in and leave in place.
So for instance, if a person wasn't getting enough blood to the leg and had a lot of pain in the leg.
Exactly. This is exactly the stent that we would use in some portions of that depending upon their anatomy. And then we've gone a step further in the technology of stents to now take stents and then cover them with graft material.
Okay.
If patient has blood flow problem to the leg, one of the solutions used to be a bypass surgery, where they would put graft from groin, say, to around the knee. Now we can actually take stent material and have a graft attached to it. And essentially these are what called stent grafts, and they have some better patency rates in some vascular systems than just bare stents as well. And then the final version of this goes all the way up to the device that I have here, which is actually, this is an aortic endograft.
Okay.
This would go in through a catheter bigger than that, but not as big as this. And if somebody has an abdominal aortic aneurysm,
and that's a weak spot that might rupture.
A weak spot that kind of is ballooned out and could potentially rupture. These can actually be deployed through a catheter, little cut downs in the groin regions instead of the big surgery for surgical repair. And then this goes in, opens up, and becomes a limbed graft. Right. A second limb would come in and attach to this to go into the iliac vessels, and essentially the blood flows through this. We exclude the aneurysm. The risk of rupture then minimizes, and usually the patients can live the remainder of their life with this in place with no risk of rupture of their aneurysm.
Now, we hope no one has these medical problems, but I guess the place for modern medicine is when you're having symptoms, and you can help alleviate the symptoms until we can teach a patient how to prevent disease with lifestyle or exercise. Well, you know, a lot of people don't realize that. Can you put these in one day and they go home the same day, or they have to stay overnight?
The stent grafts probably go home the next day. The basic angioplasty and stents themselves, they go home the same day.
Now, what are some of the other interventions that you do to treat patients?
Well, one is this little umbrella-looking device that's here on my hand. And it is what's called a inferior vena cava filter. Okay. Doesn't look like much. It looks kind of like just a skeleton of an umbrella. But what this is actually a device that is designed to capture blood clots. One of the things that patients, particularly patients that are ill, debilitated, maybe in the hospital for some period of time, they can develop sluggish flow in their legs and their pelvic veins, and that can establish blood clots. And those blood clots, probably most everybody has heard of somebody who has died from a clot that has gone to the lungs. Right. This is a device that we can implant into the abdominal vein below the heart, and it can capture those clots, prevent them from going to the lungs, thereby preventing that pulmonary embolus and the resultant consequences of that. And the neat thing about the newer versions of this, like this one here that has the little hook on the top, while the patient's ill, we can have it in. When they don't need it, we can actually go in and take it out.
Wow, that's great. Well, you know, we're going to continue to show you all the new devices that modern medicine has, and there is a place for that, but we want also everyone to have a good lifestyle. And we're going to continue to talk with Dr. Brent Barrow after this short break. Give us a call, 855-644-3278, and we're going to be getting to your calls after this short break.
The Heart of Health Live will return in just a moment.
I'm Dr. James Markham, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
Hello, I'm Dr. Tim Jennings with your Mental Health Minutes. Are you pregnant or thinking of becoming pregnant? Do you want to ensure your child will have the healthiest brain possible? Then avoid all alcohol, because as little as 1 glass of wine per week alters brain development and is associated with behavior and emotion problems. Avoid smoking. Children born to mothers who smoked had higher rates of learning and behavior problems and psychotic disorders. Take omega-3 fatty acids. Omega-3s promote healthy brains and higher IQ. And watch out for depression. Untreated depression is associated with delayed fetal growth and altered brain development. However, antidepressants can increase miscarriage rates, contribute to smaller fetal heads, and slow growth in the newborn. If depressed, consider transcranial magnetic stimulation, the only FDA-cleared, drug-free treatment for depression with no risk to the fetus. To be smart requires a healthy brain, so be smart, do right, and make your child bright.
To learn more about mental health, visit comeandreason.com.
Hi, I'm Dr. James Markham, Speaker, Director of HeartWise Ministries. And at HeartWise, our goal is to bring people into a relationship with the Heavenly Father using modern medicine and the healing principles found in the Bible. We teach people that there is a place for modern medicine and a healthy lifestyle, but it is in a relationship with their Creator where ultimate healing can occur. Over the past years, our ability to share this message of truth, love, and healing around the world has increased exponentially. But to continue this steady growth, we need your help. We are looking and praying for 100 individuals willing to give $1,000 a year. If the Spirit is moving you to become one of the HeartWise 100, won't you consider donating online today at heartwiseministries.org.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back, and thank you for spending time joining us today. I know there's a lot of programming you could be watching. A lot of people are watching the news around the world, but I'm glad you're watching us. One thing that we do a little bit different is we try to meet people where they're at, let them know that God loves them, wants to be a part of their treatment regimen. And in that relationship with Him, we can have healing no matter what happens in our lives. And we want to always point people to that. In fact, Dr. Barrows, my best medical textbook has been the Bible. Yeah, but I've learned that there is a place for modern medicine, and knowing where the balance is hard because you got the internet giving you all this stuff, and some people just focus on lifestyle, and that's important. Some people just point on pills and gadgets, and that's important too, especially if you have symptoms. But I've learned that if you sort of find where the place is. Most people don't know where that balance is. But I want to start with that relationship with the Heavenly Father. Let's go to a question here. And this comes in from our website. It says, is thermography an alternative for mammogram? So let's first tell the people, what would this device want to diagnose?
Sure. Thermography is a device that has been developed. It is not FDA approved.
Okay.
And at least in the medical societies that tend to treat breast cancer, American College of Radiology, American College of Surgeons, American Cancer Society, it is not considered a viable option or alternative. It is a device that thermo, meaning heat.
Right.
It's a device that tries to differentiate the temperature within the breast tissue.
Right.
The idea behind it is that areas that are more metabolically active would have a higher temperature.
Okay.
That's not to say that there is actually some research being done with military grade thermal imaging type devices for something like this, but those are not anything that is being clinically proven. They're nothing that is in the commercial market, and the recommendations are mammography as a screening. And thermography is not something that, at least in my training and in the societies that treat the breast cancer, it's not something that is considered a viable option.
So this is for the diagnosis of breast cancer.
Absolutely.
And of course, if you want to screen for that, so really, mammograms is sort of the gold standard in exam.
Physical exam, and first by the patient.
Okay.
Doing that monthly self-exam.
Okay.
Then the yearly exam done by their physician, and then the annual or biannual mammograms after the age of 40.
Yeah, because if breast cancer is picked up early, it's curable.
Early is by far the best. Small and early is definitely where we try to find those lesions.
Great. Well, that's a great answer. I'm going to throw in another question. Well, I think we have another question before break. If this one comes into the website, it's, my mom has dementia. Okay. What imaging test might help make this diagnosis? So I guess we wouldn't, we wouldn't do an ultrasound.
No, you're not going to do. Although, it's funny. There are a number of different kinds of dementia. Alzheimer's is what most people think about. There's also a vascular dementia or multi-infarct dementia. There's also another dementia now that has these Lewy bodies that they talk about. But as a general rule, if somebody is concerned about dementia, the initial evaluation is clinical.
And dementia means you're not thinking right, right?
Correct.
Yeah.
You have less, your functional capacity is diminished. Okay. Confusion, loss of memory, and a number of things. That is initially somewhat clinical. There are a number of things. CT is a screening test that we tend to do for most patients, basically to rule out major things. Strokes, blood in the brain, masses, things like that. More specifically, MRI imaging, structural MRI imaging is something that we will do routinely in the evaluation, looking for specific areas of atrophy in the brain.
And that's important because more and more people are becoming, having these problems with dementia. Absolutely. They want to know the cause, so then you can tailor treatments. Right. Well, we want to encourage you to ask your radiologic questions with Dr. Brent Barrow. After a break, we have Gordon. Gordon, hang on. We're going to be with you after we take a short break. And Gordon's calling all the way from the Virgin Islands, Brent. So we're going to take his call after this break. Good. You can give us a call, 855-644-3278. We're talking with Dr. Brent Barrow, who's an expert in radiology. Stay with us.
The Heart of Health Live will return in just a moment.
The Ultimate Prescription by cardiologist Dr. James Markham is taking the nation by storm. People everywhere are learning what living a healthy life is all about. If you're happy living a drug-filled, pain-filled, mundane existence, this book is definitely not for you. In this book, Dr. Markham dives into modern medicine's strengths and weaknesses and explains how lifestyle choices can significantly impact your health. To get your copy, visit Barnes & Noble or shop online at Amazon.com.
I'm Dr. James Markham, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
Three Angels Live, the first live HD streaming network dedicated to the gospel and Three Angels messages. Three Angels Tube flagship HD broadcasting service provides its users with a comprehensive set of tools for producing and managing live HD streaming content. Using Three Angels Live, you can broadcast streaming HD content from your desktop through your own branded channel. The implementation of the Three Angels Live platform dramatically cuts the cost of producing and sharing video content online by more than 50%. Whether a church or ministry, Three Angels Live will save you money while making your message even more accessible. Broadcast using your favorite desktop encoder, Adobe's Flash Media Live encoder, Telestream's Wirecast, VidBlaster Broadcast, or Nutex TriCaster. If you need it, we have it. Upload and play out your video on-demand content as linear TV-like, or offer your video as pay-per-view content to your audience. And so many more features like create unlimited channels, custom channel page designer, viewer analytics, live chat rooms, video clipping editor, Twitter, blogs. Three Angels Live. It has finally arrived. The rest is in your hands.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back. We're talking with radiologist Dr. Brent Barrow, and we have a question for Gordon. Gordon, you're on the line with Dr. Barrow. Can you hear us?
Yes, I can hear.
Okay, Gordon, talk up and talk to Dr. Barrow here. What's your question or comment?
I have a two-part question.
Go ahead.
Yes, I'm hearing. The new filters that are used for treating embolus. It is said that they can be used for 3 to 6 months, and they can be removed or they can be in place permanently.
Yes, good question, Gordon. We had just talked briefly about the IVC filter, and yes, they can. They tend to we want to take them out within the first 3 to 6 months of their existence in the body. And the reason for that is that there can be some ingrowth around the body, around the legs, that would make it more difficult to come out at a later time. They have been taken out in over a year's period of time. There are cases of that. But as a general rule, if it's being placed for a specific acute injury or illness, we would want to get those out within a 3 to 6 month period.
Gordon, do you have a specific question for Dr. Barrow?
Yes, is it necessary to remove it in the same place in which it was inserted, or any qualified radiologist can remove it?
Any qualified radiologist can remove it. Is this something that you have, Gordon?
Yes.
Can I ask you your age?
Senior citizen.
Okay.
How old?
I missed that.
How old was that, Gordon?
Senior citizen.
Senior citizen.
Senior citizen.
That's
okay.
a good one. Okay.
As a senior citizen, you know, leaving it in place would not be unreasonable.
Okay.
It should not cause any significant harm to you long term if it's left in. But if you do want it out, any qualified interventional radiologist, vascular surgeon could remove that.
Right. Thank you.
Okay,
Thank you for your call, Gordon.
Yeah, you know, that's a great question. You know,
absolutely, it affects his life.
You use it while you can, and then when it's gone, take it off. And you know, I don't know if you remember, but a few years ago they had that reporter that was in a tank, and his legs were immobile just for a few hours, and he got a blood clot that caused a pulmonary embolism. He died for that.
Yes.
So if you're out there and driving a truck or sitting in a car or don't move around, we want you to move your legs, keep those veins moving, get up walking around. You know, we don't want a blood clot in anybody.
Absolutely.
And then of course some people are at a higher risk of getting a clot, like if you've had cancer or if you're bedridden or in the hospital. So you want to make sure you keep these blood clots out of you so you don't need to have a filter. But a filter could be life-saving if you had a clot.
It sure can be.
You know, and it's just life-saving. You know, I had a patient the other day that had a leg that was swollen, and we checked with an ultrasound, and we saw a clot, but the clot had not moved. And they couldn't take a blood thinner, so, you know, they had to have a filter so to keep a clot from doing something life-threatening. I got a quick question here that's come into our website here. It says, what is the difference between a CAT scan, we talked a little bit of CAT scan, and a PET CT scan? What's the difference between those two imaging tests?
Okay, CAT scan, computed tomography, is a machine that uses radiation to look inside the body. Over the years, that technology has progressed from a single slice camera that used to just circle the body in 2.5 seconds to now having a machine that can image 128 to 256 slices per rotation in a spiral rotation, and the entire body can be scanned in just a matter of a few seconds. But it is using radiation into the patient to see what's going on.
Okay.
PET CT combines a CT scanner with a PET scanner, which is a functional exam where we inject a radioisotope into your body, and then your body emits this radiation, and again, the higher metabolically active areas, potentially, let's say, tumors, are going to have greater activity than tissue that is not that metabolically active.
Okay, like something like a fluid-filled sac, you wouldn't
have anything
so
in
you
it.
might choose which one's a cancer or which one's sort of benign.
Absolutely.
With the PET CT scan. Well, that's a great question. Well, keep giving us your calls. We're going to go to Blossoms on from New York after this break. Give us a call, 855-644-3278. We're talking with board-certified radiologist Dr. Brent Barrow. Stay with us.
The Heart of Health Live will return in just a moment.
I'd like to think that one day, when we get to heaven, we're going to see a list of people like Jared and Susan, who were introduced to Jesus because of something we said, or maybe it was as simple as a passing smile. But these people will look into their past and be able to say, I'm here because of you. Recently, you may have heard that Heartwise Ministries has begun spreading the gospel to the young, the old, the sick, and the healthy using this very television program, but we need your help. We want to take this type of medical programming to the non-believer and the person who has closed themselves off to traditional forms of outreach. If you believe as we do and want to support Heartwise so that together we can count more names on the Tree of Life, please consider donating today at heartwiseministries.org. That's heartwiseministries.org.
In the small town of Elmira, New York, a boy was born into an all-American family. The odds of him achieving his dream in the fashion industry? 1 in 23 million. The odds of having a child diagnosed with autism? 1 in 88. I am Tommy Hilfiger, and my family is affected by autism. Learn more at autismspeaks.org/signs.
I'm Dr. James Markham with your medical moment. I don't know about you, but I get thirsty if I talk a lot. Well, one of the greatest needs of our body is water. Did you realize that up to 70% of our body is water? All the chemical reactions from the brain to the heart beating to the muscles moving all depend on water. It's one of the most important substances we put in our body. If we get dehydrated, many bad things happen. We can have inflammation, we can have the blood thickened, we can have blood pressure changes, we can even have our heart race. You don't want to be walking around in the desert. Hydrate yourself. How much do you need? Divide your weight in 2, that's about how many ounces. Or drink enough water till your urine comes out clean. Remember, water is one of the most important ingredients we put in ourselves every day.
To learn more about your health and discover what Dr. Markham is doing in your area, visit heartwiseministries.org.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Okay, we have got Blossom on the line, Dr. Barrow. And if you just join us, we're talking with radiologist Dr. Brent Barrow. We're answering your questions. We have Blossom that's calling us from New York. Blossom, can you hear us?
Yes, I'm hearing you.
Okay, what's your question for Dr. Barrow?
My question is, my husband is ill. He was diagnosed with Parkinson's a long time ago, and now he's at a point where he keeps falling if you let him go. He cannot walk on his own, cannot do anything on his own. When you feed him, he's coughing a lot, and the food tends to come up he have a hard time swallowing, and the food tends to come up through his nostril, and it's like if he's going to just pass us in the coughing when he's coughing. And I want to know what kind of doctor I should take him to, because he refuses to even go to the doctor.
Okay.
I don't understand what's going on with him.
Blossom, can I ask you a question? Do you notice if liquids or solids, is one worse than the other, or are they about the same?
Yes. We try feeding him with a straw when he's having liquids.
Okay.
And I start puring his food, trying to give him things very soft things.
Good.
And the moment he starts, start to swallow, you can hear him like he's kind of gulping, and he's telling me it's like it feel like if it's like it is a blockage and he can't get it done properly.
Blossom, I think what I would recommend that you do is contact your physician and ask him to refer you to a speech therapist to have a modified barium swallow performed. And it's a specific study where a speech therapist using an x-ray equipment will give your husband barium of many different consistencies to try to see what barium he may tolerate better, solid, semi-solid, liquid, and do several different maneuvers that they could try to improve his swallowing without you having an aspiration risk, because that's really what we're concerned about. We don't want him to aspirate, get this stuff into his lungs, get pneumonia and whatever, particularly with him not being able to move around a lot. We don't want him to be sedentary and developing something in his lungs. I would get a modified barium swallow.
And it's Parkinson. It's Parkinson's disease. Like prevent you from walking, that you fall and you shake a lot?
It can have an effect on, even swallowing and motor function in general. There are also
hallucination also.
Yeah, and that could also be a dementia that can be setting in as well, because some of the hallucinations are more common, I think, with one of the forms of dementia. He also probably should be evaluated by his doctor just to make sure that he hasn't had a stroke. And he may need to have some sort of a little...
He did have one like 2-3 years ago, a slight stroke. I did not ignore it at the time.
Right, but sometimes those strokes can progress over time, or you can have a progression of a stroke in that area. Clinically, it may not be very evident, but your symptoms kind of progress and get worse. So sounds like he may need to get worked up for both stroke, but I would also have him see a speech therapist for that modified barium swallow. Thank you, Blossom.
Speech
therapy. And Blossom, another thing I want to add in is a neurologist is usually the one that specializes. This is the doctor that specializes in those type of conditions.
Absolutely.
So you might want to check in and get a referral to a neurologist as well.
Okay,
all right. And we will pray for you and your husband, Blossom, okay? And we hope everything goes well.
That's what I've been doing, praying, because our faith in God and as born again Christians.
Thank you for calling.
God is able to. Thank you so much.
Okay, thank you. And Brent, that's an important point. Lots of times we have bad things that happen to us, and modern medicine can't fix everything. Lifestyle can't fix everything. But in that relationship, we can have peace and know that God, in His time, is going to heal us.
Absolutely.
After break, we're going to go to a call from Oregon, so we hope that caller's still on us, and we still have a little bit more time to take calls. We're 855-644 3278, talking to Dr. Brent Barrow, and we want to invite you to visit our website. That's heartwiseministries.org, where you can also leave questions. And we also want you to join us and be a Facebook friend, and you can know who might be on the program for next week. So stay with us. Go get a glass of water. We're going to be right back answering a question from Oregon after this break.
Heart of Health Live will return in just a moment.
Hello, I'm Dr. Tim Jennings with your Mental Health Minutes. Are you pregnant or thinking of becoming pregnant? Do you want to ensure your child will have the healthiest brain possible? Then avoid all alcohol, because as little as 1 glass of wine per week alters brain development and is associated with behavior and emotion problems. Avoid smoking. Children born to mothers who smoked had higher rates of learning and behavior problems and psychotic disorders. Take omega-3 fatty acids. Omega-3s promote healthy brains and higher IQ. And watch out for depression. Untreated depression is associated with delayed fetal growth and altered brain development. However, antidepressants can increase miscarriage rates, contribute to smaller fetal heads, and slow growth in the newborn. If depressed, consider transcranial magnetic stimulation, the only FDA-cleared, drug-free treatment for depression with no risk to the fetus. To be smart requires a healthy brain, so be smart, do right, and make your child bright.
To learn more about mental health, visit comeandreason.com.
The Ultimate Prescription by cardiologist Dr. James Markham is taking the nation by storm. People everywhere are learning what living a healthy life is all about. If you're happy living a drug-filled, pain-filled, mundane existence, this book is definitely not for you. In this book, Dr. Markham dives into modern medicine's strengths and weaknesses and explains how lifestyle choices can significantly impact your health. To get your copy, visit Barnes & Noble or shop online at Amazon.com.
I'm Dr. James Markham, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back again. I'm Dr. James Markham, and that voice you heard in the background was Charles Mills. Welcome you back again. We want to thank you for taking the time to join us tonight. And we're going to be, every week, we're going to have a specialist in talking about something that I hope interests you, letting you know that there's hope out there in a healing relationship with God, but also pointing you ways to stay healthy and learn about what's out there in modern medicine. Because, like I say, we're going to give you an honest answer. We're not trying to sell a product. We just want to thank Dr. Barrow for joining us today and sharing with you. Because when you share with each other, you know, knowledge helps relieve anxiety, which also helps someone's symptoms when they're not worried about something.
Absolutely.
So let's go to Oregon. I think is it Cher from Oregon's calling?
Yes, it is.
What's your question for Dr. Barrow?
Okay, I'm 59 years old, and I'm very sedentary. I have a really weird pain in my leg below my knee, and it feels like there's a little elf in there kicking you. It hurts really bad if you squat down, try to pick something up. I'm wondering if that is a clot, or is that something they call a thrombosis? How can I find out if it is?
Sure.
What kind of imaging would that be?
Okay. Cher, can I ask you a couple questions?
Sure.
Is this a pain that kind of radiates down your leg, or is it just always in your calf?
It's always in the calf.
Okay. Is it happen when you're walking and moving around, or can it happen when you're just sitting on the couch?
Mostly, I notice it when I'm sitting cross-legged on the bed, reading my Bible and stuff, and then I go to get up, and I can barely go. The pain is so intense.
Okay. The reason why I ask those questions is there are a couple of things that anytime patients have leg pain. One is called claudication, and that's something that if you have blockages in your arteries, you can have a reduced blood flow as you walk and exercise, and that can cause you to have ischemia or pain in your legs. After some period of distance, you stop, the pain goes away, you recover a little bit, and you can do it again. But it doesn't sound like that's your case.
No.
If we want to make sure there's not a blood clot there, what you need to get is an ultrasound. That would be a Doppler ultrasound of your leg, and they would start all the way up to the groin, actually, because even though you're not symptomatic up there, you have a blood clot that can propagate all the way up to there or beyond. And they will carry down from there, down the thigh, down behind the knee, and then down into the calves trying to find that area. And they may also ultrasound specifically over this area of interest of yours where the pain is. There may be a little cyst there. You could have a Baker's cyst that kind of has come from the knee into that area and has caused you some pain. So I would probably start with an ultrasound.
Okay. Do you know about how much it would cost to do something like that?
You know, that's a great question, and I really don't. It's going to depend upon probably, if you're doing it in what facility. Even some doctors' offices even can do this in their own office, and that may be a way to have a reduced cost. But I would talk to your primary care physician and see if he can get you set up for that.
Okay. I don't have a primary care, but I could maybe go to immediate care.
Absolutely.
Right, they would be able to set you up.
Absolutely, they should be able to set you up. And thank you for your call.
Is there any way that this thing in my leg could be related to this ongoing pain in my left shoulder?
Probably not. Probably not. It's probably something different.
Yeah.
Thank you very much.
Well, thank you.
Thank you for calling.
You know, I know there's many people out there. Our phone lines have been full, and if you can't get through tonight, don't worry, Dr. Barrows will be coming back, and you can always go to our website where you can leave a question, and we'll answer it, the ones that come in our website. So if you can't get your question answered tonight, listen, because sometimes one person has a question that many people have. We're about out of time on this break, but we're going to come back and answer as many questions as we can after break, Dr. Barrows. And I'm just glad you joined us, because these are very interesting things, and we never can cover everything. And these devices, what you put in and making a diagnosis, and you know, I think this is just very important for people to know. So if you haven't got your question answered tonight, go to our website, or we're going to have Dr. Barrows on again, or go to our Facebook account where you can know who's coming on next week, so you might have your question answered. We're going to be right back. We have another segment that's coming your way on Heart of Health Live.
Heart of Health Live will return in just a moment.
I'm Dr. James Markham with your medical moment. I don't know about you, but I get thirsty if I talk a lot. Well, one of the greatest needs of our body is water. Did you realize that up to 70% of our body is water? All the chemical reactions from the brain to the heart beating to the muscles moving all depend on water. It's one of the most important substances we put in our body. If we get dehydrated, many bad things happen. We can have inflammation, we can have the blood thicken, we can have blood pressure changes, we can even have our heart race. You don't want to be walking around in the desert. Hydrate yourself. How much do you need? Divide your weight in two, that's about how many ounces. Or drink enough water till your urine comes out clean. Remember, water is one of the most important ingredients we put in ourselves every day.
To learn more about your health and discover what Dr. Markham is doing in your area, visit heartwiseministries.org.
My life is full of statistics. Thing is, I could have dropped out of school and become one myself, but I didn't, because I had people that believed in me. Here's another statistic. 7,000 students drop out every school day. That's one every 26 seconds. It's time that students know that we believe in them.
Inspire a student and share your message of support at boostup.org.
I'd like to think that one day, when we get to heaven, we're going to see a list of people. People like Jared and Susan, who were introduced to Jesus because of something we said. Or maybe it was as simple as a passing smile. But these people will look into their past and be able to say, I'm here because of you. Recently, you may have heard that Heartwise Ministries has begun spreading the gospel to the young, the old, the sick, and the healthy using this very television program. But we need your help. We want to take this type of medical programming to the non-believer and the person who has closed themselves off to traditional forms of outreach. If you believe as we do and want to support Heartwise so that together we can count more names on the Tree of Life, please consider donating today at heartwiseministries.org. That's heartwiseministries.org.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
We've been talking with Dr. Brent Barrow, and we're going to answer as many questions as we can in our last segment today, Brent. So our first question is from Allie. Allie, you're on with Dr. Barrow.
Hi, Allie.
Hello.
Hello. What's your question?
I was wondering if X-rays could show parasites or mites. I've been told that I have something called Morgellons disease, where it feels like insects crawling up under my skin. I've lost a lot of weight. My appetite is enormous, but I've lost a lot of weight. It's like whatever this thing is, it's eating my flesh.
Okay. Oh my. Thank you for your call. Mites on the skin are typically not something that we're going to be able to see, Jim. But some parasites, particularly some of the parasites in the GI tract, with certain imaging studies, we can see those. But that doesn't sound like that's something that Allie has. But but skin mites and things like that, not actually something that we're probably going to be able to see.
Might need to be with a biopsy, right?
Yeah, absolutely. I know we have one other question. We know we have another caller, right?
Yeah, well, thanks for your call, Allie. We're going to move to the next caller real quick. Monica, you're on us with Dr. Brent Barrow.
Yes, thanks for taking my call.
Hi, Monica.
How are you?
I'm good. What can we do for you?
My grandmother has a swollen foot.
Okay.
It is not as swollen as it was a few days ago.
Okay.
But what are the symptoms of a blood clot?
Okay. Well, great question, and it's absolutely exact. Peripheral swelling is one of the first things that you will see. There's a sign that is called the Homan sign. If you were to, with your foot, press the foot forward with the legs stretched out, if that causes some pain, that is not absolute, but it is questionable at least that it raises the possibility that there may be a clot there. But if there is swelling and they haven't had some sort of an injury or trauma that would potentially cause some of that, that needs to be checked out. Right. But you can have, in an elderly patient, they can have a venous problem with blood clot, but they can also have an arterial problem. There can be a arterial blockage or obstruction or diminished flow to that leg, and that can be a secondary cause for that ischemia and the swelling in that leg.
And would you start with an ultrasound on this?
Again, start with an ultrasound, a Doppler ultrasound to evaluate for the veins. If a doctor evaluates them and they think, well, maybe the pulses are diminished in that leg or that foot, if there's an ulceration or there's a poor healing wound on that leg, then you really start being more concerned about maybe an arterial problem and not just a venous blood clot problem. But,
okay.
But I always start off with an ultrasound.
Okay. Now, let me ask you, would a hot and cold treatment do any harm to that?
With a what?
Hot
and cold.
Hot and cold treatment. You know, the thing you have to be careful with both hot and cold, you can be too cold and you can burn the skin, just like you can be too hot and burn the skin. So elevation is good, raising it above the heart.
Okay.
Moderate cool, moderate warmth, particularly if you think it's a cellulitis and it's infected related. But I would always want to make sure that we do not have a blood clot.
Okay.
Well, thanks for your call.
Thank you for your call.
And unfortunately, we have run out of time, Dr. Barrow, so we want to thank you for joining us today on Heart of Health Live. And if you might have a question out there, give us a call next time or go to our Facebook page. We can see our guest network. I'm Dr. James Markham with Dr. Brent Barrow. We want to thank everyone for their questions, realizing that there's a God in heaven that's going to heal us all perfectly, regardless of what the ailments we have here. Thanks for joining us tonight on Heart of Health Live.